Hello, my name is Vanessa, and these are some questions that are for review after you've seen the carpal tunnel syndrome whiteboard breakdown in my last video. Okay, question number 1. The answer is B, the median nerve. The median nerve travels within the carpal tunnel with the other 9 tendons, and if the median nerve is inflamed or there's any inflammation within the wrist and the carpal tunnel, that will compress that median nerve, giving them positive CTS syndrome and giving them those pains and discomfort sensations. So it's asking what is not typically associated with CTS, and that's going to be A. Typically, you're going to see those sensations like pins and needles, numbness, tingling, electric type pulses, and pain. It's not common to have discoloration of the skin. That's not one of your initial symptoms of CTS. If there is discoloration of the skin, you definitely want to refer them back to the physician for further testing. This is not meant to be a question in the beginning. It's merely a typo. It's asking or stating that you do have a 42-year-old female patient in your outpatient clinic referred by her primary care physician. The patient reports heightened pain in the morning. What intervention would you use initially? Okay, so in the outpatient clinic setting, you typically are seeing the patient for a shorter amount of time. A lot of times the patients just show up to the evaluation and they don't, they have poor compliance. Maybe you may not see them back, or due to their work schedule, if it's something that occurred, maybe they don't see it as, maybe a big deal in the beginning. So are they going to comply with their visits and coming more often? You want to get all the information you can within your eval and then make every treatment session very impactful. One, because you want to kind of build that rapport and let them know how this can kind of progress and it can get worse, so that they're following through with their treatments. So you would want to start with A, educating them on proper positioning of the wrist. Make sure they're not doing any excessive wrist flexion or extension, that they're keeping proper alignment of that wrist. Neutral is best. When it's already inflamed and they're having so many symptoms, you want to reduce how much they're bending that wrist and kind of that sustained grasp if they're carrying things at work for a prolonged amount of time. You also want to possibly, if they're having a lot of pain at night during sleep, or even report of heightened pain in the morning, you can even recommend splinting. The other options are great, but initially you would want to educate them on proper positioning of that wrist. Okay, so you want to be thinking more of D. In that pamphlet, it shouldn't say seek medical attention or seek therapy, rehabilitation if the symptoms are unbearable, or if you're having too much pain. That's when you want to seek alternate treatment. You always want to let them know that there's even ways of prevention that we can educate them in, giving them recommendations, modifications of their work or home environment, and there is a such thing as too late, because if you get to that point of needing surgical intervention, you're gonna wish that you had gotten it earlier. So definitely always let them know when they're first having those signs and symptoms, or they're first diagnosed. That's kind of the time to start getting educated on what to do, what not to do. Okay, so the answer is C. you want to teach them how to do proper tendon glides and nerve glides. These are specifically important for CTS because you want to get that median nerve to be able to glide within that carpal tunnel. Okay, so the more effectively that nerve can glide, you're going to see an improvement in strength, range of motion, and some of those symptoms of pain and discomfort will decrease. Okay, so you want to think more along the sides of A. I know it will be kind of hard for some people to overhear something and want to correct them, but that coda is build rapport with that patient. You don't want to kind of assert dominance over them, and then that relationship that they carry can be altered in any way. You want to be as professional as possible, but you do want to address it just so that the coda is aware and not giving false information unintentionally. So definitely in a polite manner, you know, sometime after the treatment, away from the patient or off to the side, just be like, hey, I was overhearing that, and actually, you know, it is one of the risk factors of CTS. A lot of people don't think it is, but it is. But always teaching codas some information because we were there ourselves, and we definitely want to err on the side of professionalism. Okay, so the answer here, although we do not prescribe medication, we can also always talk to the physicians or the physician assistant and, you know, just kind of ask if they've thought about that. Sometimes these things kind of slip through the cracks, but you want to be looking at D, some kind of anti-inflammatory that can help the patient with their symptoms of pain, discomfort, inflammation. The less inflammation we have in that carpal tunnel, the more effectively that median nerve has that space to glide between those tendons, or over them rather, and less compression to the median nerve will definitely reduce some of those sensations. So on this one, you want to be thinking about the prayer stretch, okay? That's when you bring your elbows, arms, keep them adducted to your side. Then you want to bring the elbows up to 90 degrees. Press your hands together. Wrists are in extension, and you are giving that just a slight squeeze. They can hold this for 10, 15, even 30 seconds and do multiple reps. The prayer stretch is really good because it's going to give you that passive stretch to the wrist, also help elongate some of those muscles and help for strengthening.
It's for my quest.
So the answer here, as we know, is going to be B, because carpal tunnel syndrome is an impingement or compression of the median nerve. Okay, so you want to think as carpal tunnel being just like a tunnel essentially of the wrist, and what's going through there is going to be the house of 10. It's going to be those 9 tendons and the median nerve right down the middle. Okay, so when we're compressed there, you can put your 2 fingers as if you were checking your pulse and just go ahead and press down there. You can see if that was compressed for a long amount of time. If you add some pressure, you may also start to feel some numbness or tingling or just like decreased movement in your wrist and hands because you're compressing all of that. Okay, so that's kind of that sensation that it gives. Any compression of the median nerve is going to be positive for the CTS. And lastly, okay, so you want to be looking at D. All right, so if they were carrying their plate, you wouldn't want someone to carry their plate like this, where you can have some flexion, extension, some flexion or extension of the wrist. You want them kind of neutral. If they can hold the plate like that, if it's a bigger plate, they can hold it out like this. But as much as they can keep that wrist in neutral, that will help to decrease some of those symptoms. Thank you so much. These are my references.